Here we'll learn about pneumonia. To begin, start a table and to note that pneumonia is infection of the lung parenchyma, which causes inflammation and fluid accumulation in the alveoli. Infection occurs when impaired local or systemic defenses allow the infiltration and proliferation of bacterial, viral, or fungal pathogens. In some patients, multiple pathogens are present, and bacterial pneumonia secondary to viral infections common. Pneumonia symptoms are often classified as typical or atypical, and are sometimes associated with specific pathogen types. However, overlap and inconsistencies make clear-cut categories difficult. To note that typical pneumonia is characterized by an acute onset of fever, malaise, productive or non-productive cough, dyspnea, and chest pain. Atypical pneumonia is sometimes referred to as walking pneumonia because symptoms are milder and onset is gradual. For example, fever is absent and respiratory symptoms are less severe. To note that we may hear pulmonary crackles, egophony, wherein an E sounds like an ah during auscultation, and bronchial breath sounds. Tachycardia and tachypnea are also common. Be aware that pneumonia may present differently by age. For example, elderly patients with pneumonia may experience confusion, whereas GI symptoms are more likely in children. On chest x-ray, we'll see consolidations from edema, and we can test for the presence of microbial pathogens. However, be aware that causative pathogens are often not identified in pneumonia patients. To note that pneumonia is the number one infectious cause of death. It can lead to acute respiratory distress syndrome and or sepsis. Click the links in our notes to review these pathologies. Pneumonia is a significant cause of childhood illness. To note that in children under 5 years old, respiratory syncytial virus is the most common cause. In children older than 5, bacteria, including Streptococcus pneumoniae, Mycoplasma pneumoniae, and Chlamydia pneumoniae, are the most common causes. Now let's begin our diagram of the pathophysiology of typical pneumonia. Indicate that the first step is the failure of local or systemic defense mechanisms. For example, show that inhibition of microbial phagocytosis by resident alveolar macrophages allows invasive pathogens to proliferate. Macrophage inhibition can be caused by both alcohol and cigarette smoke, amongst other things. More generally, patients with systemic immune deficiencies associated with HIV, cancer, immunosuppression drugs, etc., are also vulnerable to pneumonia. Local mechanical failures allow accumulation of pathogens and fluids. As an example of a cause of mechanical failure, indicate repressed cough reflex. This can be due to neuromuscular disorders, coma, drugs, etc. Another example of mechanical failure is mucociliary impairment in the tracheobronchial tree, which can be caused by cigarette smoke, most notably, as well as genetic defects, such as in cystic fibrosis, and viral infection, etc. Now show that defense system failures allow pathogens to infiltrate the lungs and proliferate. Indicate that this triggers the immune system. Show that infiltration of neutrophils and other pro-inflammatory mediators produces alveolar and interstitial inflammation. If inflammation goes unchecked, show that damage produces leaky alveolar walls and pulmonary capillaries. As a result, the alveoli fill with fluid, pro-inflammatory molecules, blood cells, and pathogens, and gas exchange is impaired. Notice that we see a similar pathophysiologic process in acute respiratory distress syndrome. Pneumonia types can be described and categorized by histopathological patterns, acquired settings, and pathogenic causes. Let's look at some typical pneumonia histopathologic patterns. First, indicate that lobar pneumonia is characterized by continuous inflammation in a lobe, lobes, or the entire lung. Bronchopneumonia is characterized by infection that begins in the bronchi and spreads as patchy bilateral inflammation. To learn about interstitial pneumonia, see the links in our notes. Return to lobar pneumonia and indicate that we'll learn the 4 key stages of bacterial lobar pneumonia. Show that The first stage is congestion, in which the lungs are heavy, red, and baggy from engorged vessels and edema, with blood and bacteria in the alveoli. Congestion is followed by red hepatization, in which the lungs are pink with red blood cells, neutrophils, and fibrin. They are dry and firm like the liver, hence hepatization. Next, show that gray hepatization is the result of lysed red blood cells and fibrinopurulent exudate. Finally, show the resolution phase occurs when cellular debris and fibrin are removed from the lung tissue. Alveolar macrophages predominate. Next, let's learn about pneumonia types based on pathogen acquisition: community-acquired, hospital-acquired, also known as nosocomial, and ventilator-acquired. We'll list the pathogens most commonly associated with each of these settings. This can be helpful in determining a treatment course. Again, see the links in our notes for pathogen details. First, indicate that community-acquired pneumonia is pneumonia acquired in any non-hospital setting, including assisted living and rehabilitation centers. Write that typical bacterial pneumonia pathogens include the following: streptococcal pneumonia, which accounts for roughly 15% of pneumonia cases in the U.S. and 30% worldwide. Indicate that the pneumococcal vaccine protects against this form of pneumonia. Write that Haemophilus influenza is another common bacterial culprit. Indicate that methicillin-resistant Staphylococcus aureus produces a particularly severe infection. As a rule, it's an uncommon source of community-acquired pneumonia, but with the use of antibiotics, it's been on the rise. Next, write that common causes of atypical bacterial pneumonia are Mycoplasma pneumoniae, Legionella, and Chlamydia pneumoniae. Indicate that these pathogens are often associated with interstitial pneumonia. Atypical bacteria are difficult to identify using standard methods, as opposed to the gram-positive and gram-negative typical bacteria. Indicate that fungal causes of pneumonia include Histoplasma and Coccidioides. Viral pneumonia is increasingly common even in immunocompetent individuals. So let's list out the following common culprits: influenza A and B, rhinoviruses, parainfluenza viruses, adenoviruses, and respiratory syncytial virus. Recall that RSV is a common cause of pneumonia in children under 5 years old. Now indicate that hospital-acquired pneumonia, also known as nosocomial pneumonia, is defined as pneumonia acquired 48 hours or more after inpatient admission and includes post-operative infection. Indicate the following common causes: methicillin-sensitive and methicillin-resistant Staphylococcus aureus, Streptococcus pneumoniae, Pseudomonas, and several enteric bacteria, including Klebsiella, E. coli, and Enterobacter. Lastly, in this section, write that ventilator-assisted pneumonia is defined as pneumonia acquired 48 hours or more after endotracheal intubation. Common culprits include Pseudomonas and methicillin-sensitive and methicillin-resistant Staphylococcus aureus. Before we conclude, let's consider aspiration pneumonia and pneumonia in immunocompromised individuals. First, indicate that aspiration pneumonia is the result of aspirated gastric secretions or fluids from the upper respiratory tract. Common culprits include those associated with community-acquired and hospital-acquired pneumonia. Oral anaerobes can also cause pneumonia. Then write that immunocompromised patients with pneumonia often have the atypical presentation. Common pathogens include community-acquired pathogens and the following opportunistic pathogens: pneumocystis, cytomegalovirus, CMV, aspergillus, candida, and cryptococcus. This concludes our diagram.